Why are tooth cracks and fractures considered the third leading cause of tooth loss worldwide? Hello, I am Marwan Abou-Rass, trying to answer those questions with 10 reasons. I am proposing that the third leading cause of tooth loss in dentistry is not the crack itself, it's misdiagnosis. In this presentation, I will introduce 10 clinical realities. 10 clinical realities of tooth structure cracks, and each one leads to the same conclusion. We are not losing teeth because cracks exist. We are losing teeth because we fail to recognize them early and manage them correctly. So the 10 reasons or realities are: first, tooth cracks are underemphasized in dental education. We teach vertical root fractures, oblique root fractures, horizontal root fractures. We teach taxation injuries. We teach crown fractures, complete and partials. But we neglect the earliest precursor of vertical fractures is cracks. Second, cracks are treated as mechanical accidents, but they are really biological entities. They harbor bacteria. They initiate pathology. They influence pulp and periodontium and tissue. They influence restorations. Third, the most cracks are hidden under crowns, under large restorations, and we're not used to removing crowns. We do endo through them. And when we treat through existing restorations without removing them, as we always called for, we are taking a risk that there is a crack, and that crack is going to be triggered. 4, the terminology of tooth structure crack is absolutely chaotic in the literature. More than 26 terms, 7 classifications that I counted. No universal definition. And when you have a problem in communication, you're going to have a problem in treatment. Fifth, when treatment fail, I've seen it so many times, we blame hidden cracks. The cracks becomes a scapegoat instead of examining our diagnostic process and see what did go wrong. 6, we rely on simplified flow charts. They're all over the literature for a condition that is so complex. 7, the traditional tooth structure crack management lacks evidence and biological support, evidence-based. Clinical dogma is there from 50 years. We do a lot of unnecessary treatment, stabilization, bite testing, or all of that. 8, radiographs rarely reveal early cracks. Negative imaging does not mean absence of disease, you know that. And even CBCT has limitation when it comes to line cracks. 9, when we apply traditional endo and traditional restorative standards to a cracked tooth, it doesn't work. We need to modify the endo treatment or restorative treatment. And the 10th, cracks deem knowledge, interdisciplinary knowledge in endo, imperio, in resto, in prosto, to make an accurate diagnosis. We will explore each one of these 10 realities in depth with clinical cases, scientific evidence, and long-term consequences. Because when diagnosis improves, tooth survival improves. Let's move from confusion to clarity. Thank you for listening.